Get to know the Move Your Way campaign. People in our communities need physical activity to be healthy. And the Physical Activity Guidelines for Americans clearly states how much activity people need based on the latest science. But most people still aren't getting enough. And that's where Move Your Way comes in. Move Your Way is a national campaign launched by the U.S. Department of Health and Human Services to help Americans get active. The Move Your Way campaign adapts the physical activity guidelines into information everyone can understand and use, no matter their age, abilities, health status, or fitness level. Move Your Way aims to reach people who aren't active enough yet, but who are thinking of making a change. And to reach them, Move Your Way is changing the conversation about physical activity. Being active has great health benefits. But for many people, getting active isn't easy. They're surrounded by messages that make physical activity feel unachievable, overwhelming, and all or nothing. Move Your Way shows how manageable and adaptable physical activity can be, and how to work around barriers like lack of time or access to facilities. Move Your Way means lots of things count as physical activity. Even everyday tasks like cleaning your house and walking your dog. It all adds up. Even a few minutes of moving more each day has real benefits. Find activities that work for you, so it's easier to stick with them. Move Your Way is ready to use with a suite of fact sheets, posters, videos, and interactive tools tailored to different audiences like older adults, parents, kids, teens, and pregnant and postpartum people, and based on people's needs. Move Your Way materials are tested with diverse groups of people to make sure they're clear, informative, and accessible. And all materials are available in English and Spanish. It can be hard for people to get active on their own, and that's where you come in. Community organizations like health departments and nonprofits can use Move Your Way to help their communities get active. You can make Move Your Way work for your community, whether that means starting a brand new local initiative or using Move Your Way materials in your existing activity programs. Do it your way. Plan events, big or small, that make sense for your location. Use Move Your Way's ready-made materials or adapt them for your community. Post Move Your Way's grab-and-go social media messages and graphics. Or start your own social media challenge. And you don't have to start from scratch. 10 communities across the U.S. tested out Move Your Way with events, new programs, and social media messages to get people in the community moving. Their experiences helped inform a community playbook with tips and materials to help communities of any size, location, or budget promote physical activity. The playbook has resources to help you do things like plan community events, build a budget, work with local schools and businesses. Everything you might need to bring Move Your Way to your community. You can find the playbook on health.gov as part of the Move Your Way Community Resources website. Here's how 3 community partners describe their experience with Move Your Way.
Move Your Way is really key to Active Southern West Virginia's health education efforts. It gives us a way to interact with our audience online and through partnerships. We use the community playbook to identify partners and work with them on a health education campaign. For example, we partnered with a local library in a small West Virginia town to add an obstacle course to their bookmobile program, and then to distribute the Move Your Way fact sheets for kids. Now kids can get their dose of physical activity when they come to get books and use the free Wi-Fi.
Before Move Your Way, the Siouxland District Health Department used different campaigns, curricula, and programs at the same time. Having one message has made our work easier and more impactful in the community. People now see Move Your Way and know what it's all about. For example, we partner with local healthcare providers and clinics to reach pregnant and postpartum people. We distributed over 2,000 bags with Move Your Way fact sheets and goodies to expectant parents in our area.
The Move Your Way resources were easy to adapt for our organization's needs. The Southern Nevada Health District serves just over 2 million residents. many of them native Spanish speakers. We were able to pick and choose what we needed and find fresh ideas to reach our communities with voices they trust and are ready to engage with.
Now it's your turn to move your way and get your community moving too. Find all the Move Your Way resources at health.gov/moveyourway/community resources.